why your neck pain keeps coming back, and the cycle that nobody talks about. Let me describe a patient I see almost every single week. They come into my clinic and say, "Hey doc, my neck felt great for a while, but it came right back. I did the exercises, I got the massage, I even bought a new pillow. What am I doing wrong?" If that sounds like you, I want you to hear something important. You're not doing anything wrong. You're stuck in a cycle, and nobody has explained that cycle to you until now. I'm Dr. Robert Moss, and welcome to Prime Mover Health. I've been a physical therapist for 28 years, and today I'm going to show you the pattern that keeps neck pain coming back and how to finally break it. So early on, people start to have pain, and here's the cycle. The pain starts, and you decide, okay, I'm going to do something about it. So if you want more about it, look at our 3D video that we'll put a link to up here, over there, somewhere around here. Anyway, we'll talk more about it in our the 3D method. But you start to find some type of temporary relief, whether you're doing some stretching, you're trying a hot pack, ice pack, maybe you're trying some medications, maybe you go out and buy a bunch of new pillows. And the pain starts to decrease, so you stop doing anything about it. Then the problem is the underlying cause that was causing the pain in the first place was never fully addressed. You just masked the symptoms. And the pain often returns, often worse. And truthfully, most patients live in steps 2 and 3. They're back and forth. They're managing the pain, not solving it. And I get it. Life is busy. And when you get busy and the pain starts to go away, you just start to move on. But here's the thing. The reason it came back is because the cause never left. So frequently we'll see several patients, and last week was no different. Well, I had a lady that came in and we had treated her several years ago for neck pain, and she had been dealing with the neck pain off and on for several years, and finally it's back bad enough where she's in the clinic for treatment. And one of the first things I always ask return patients is, in addition to how are you doing, but have you been doing the home exercises that we prescribed for you when you were in for therapy the last time? And she kind of did this. She kind of looked down sheepishly, then she looked back up and said, no. And that's very common. We get busy. People do not continue to exercise. And this is exactly what happened. She didn't stay on top of it. She didn't continue to manage her symptoms and continue to make things stronger. And the symptoms started to come back. This can lead to lots of frustration and actually kind of losing hope, because you get stuck in this cycle and you think, well, it went away, but why is it back? I didn't really do anything. And so that's what we're going to talk about a little bit more today. But the other point about this is where the prime mover philosophy actually starts to matter. Okay, you have to be the driving force in your own recovery, not just a passive recipient of temporary fixes. In 28 years, I've found that recurring neck pain almost always comes down to 3 things that nobody addresses. Number 1, motor control deficits. What does that even mean? So basically it means your brain has forgotten how to stabilize your neck properly. This isn't about strength, it's about timing and coordination. So think about it. A concert pianist doesn't just have strong fingers, they have precise control. Okay, driver number 2, thoracic spine stiffness. We talked about this in a prior video, but basically the mid-back locks up, it gets stiff from sitting, and the neck begins to compensate. So if you treat the neck without treating the mid-back, you're only fixing half the problem. That's why we address the neck and the upper thoracic region. And number 3 is lifestyle load management. Basically, this means your sleeping posture, your workstation setup, your phone habits. If your daily habits continue to reload the problem in the tissue faster than your exercises fix it, you'll never get ahead. So for problem number 1 with the motor control, in our prior video, we talked about doing a deep neck flexor strengthening. So it's a slight nod of the chin here as you're laying down. And so you're working your head against gravity to strengthen those muscles. We also talked about mobilizing or stretching that upper thoracic spine over a chair or a foam roller. That is another one that you can work to help improve that as well. And the third one that we just talked about is your daily postures. Maybe sometimes you have to have someone snap a photo of you while you're working at your desk or you're at the house. Frequently, I see it all the time, patients in the clinic, they're sitting there waiting and they're just forward head posture, they're down looking like this, and you load that neck long enough and things are going to start to hurt. Okay? So let's talk about breaking the cycle. So here's what breaking the cycle actually looks like. And this is the heart of what we teach at Prime Mover Health. So you have to think about the difference between pain management or just managing your pain and pain resolution. If you just manage your pain, that could easily be done with over-the-counter meds, ice packs, hot packs, injections, things like that. Pain resolution is actually working to find the root cause of the problem, which is what we do all the time in the clinic. And if you don't address those underlying mobility or strength and stability issues and motor control issues, then that pain is going to continue to persist, and you're going to just be stuck in this vicious cycle of trying to manage the pain and not really get it to resolve. And in order for us to fully resolve the pain, we have to start to gradually load the tissues in an appropriate manner. Start building your neck's capacity so it can handle your life, your daily activities without breaking down. Think about this. If you were going to go train for a marathon, you wouldn't just go out and try to run 26 miles on the first training day. No, you may be so out of shape, your goal is to just walk down the block and back. And then slowly over time, you build up the endurance, you build up the tissue quality to be able to start doing some light jogging, jog walk cycles, that sort of stuff. That's what we have to do with the tissue of the neck, is we have to start slow and start to build up the overall tolerance. So the goal with that is to never feel a twinge of pain again. You probably will, right? The goal is to build a neck that's resilient enough to handle your day without needing constant treatment. That's what moving well actually means. Now, if your pain is very intense, it's lasting longer than 4 to 6 weeks, it's getting progressively worse, it is waking you up at night, you have pain that's referral pain, you're shooting down your arm, you're having other neurological issues, you're trouble speaking, trouble swallowing, those sorts of things, you feel like your legs are dropping out from underneath you, you have balance coordination issues, those are serious signs that you definitely need to get evaluated. Now, if you've been stuck in this cycle and this video finally gave you some type of clarity, drop a comment below. Tell me how long you've been dealing with this. I read every comment and I'll do my best to point you in the right direction. Make sure you also subscribe to Prime Mover Health if you want real answers from someone who's been in the clinic treating for almost 30 years now. Next week, I'm going to show you the 5-minute daily routine I give my own patients to help keep their neck pain from coming back. You don't want to miss it. So until next week, move well and live well.